May 1st is the start of Mental Health Awareness Month. So it was first observed in 1949. The month raises awareness surrounding mental health, including fighting the stigma, educating each other, and advocating for policies and support. And as we come out of the pandemic, new data from Mental Health America reveals that the percentage of people experiencing anxiety remains higher than the rates that we saw prior to COVID-19. Rates particularly severe for both children and the BIPOC community. Joining us live this morning to break down this new report is Mental Health America President and CEO Schroeder Stribling. Schroeder, good morning to you.
Good morning.
So this is very interesting and important data. Talk to me about, in addition to the increased feelings of anxiety, what else were some of the takeaways you saw from this latest screening?
Yes, well, first of all, thanks for having me on and for raising awareness about the topic in general. As you mentioned, Mental Health America began Mental Health Month in 1949, and we view May as a very important time to raise awareness and to be talking about the issues around mental health. And in conjunction, as you mentioned, we are releasing a report from our National Prevention and Screening Program today. And this is a free and anonymous resource that we launched in 2014 where people can go and check in on their own mental health. In 2022, 6.3 million people did just that. They went to the site and were able to take one of 11 self-tests to get more insight about their own mental health and well-being. What we found was distressing, however, not inconsistent with what we've seen in our own earlier data and what we've all been reading about from other data sources as well. And really the most concerning headline is about youth. So about half of those 6.3 million screeners were 24 years and younger. And half of those youth who took a screen for depression, which is our most popular screen, about half of those youth who took a depression screen reported that they're having frequent thoughts of suicide. So this really tells us, it signals to us what we have known, but just how great a crisis youth are in and how much distress and despair they're feeling.
Obviously difficult to hear, but important to face. So we know that our environment and our surroundings can have an impact on our mental health no matter our age, but sometimes things are difficult to change. We saw that during COVID-19. What can people do if they're having trouble coping with an environment that they cannot change?
Well, the first thing to do is to understand, as you mentioned, our toolkit this year, we choose a theme each year for Mental Health Month, and our theme this year is look around and look within. So really understanding what it is about our natural and our built environments that affects our mental health, and then understanding what it is that we can do to improve our mental health and well-being with the circumstances that we have. So as you point out, there are things in our environments that we have greater or less control over. Knowing what those are is a first step. And then understanding what we can do with what we have is the next step. So there are lots of tips and tricks in our toolkit about how to make changes in your environment, maybe even just in the room where you live or the apartment where you are or the neighborhood that you're in. This could involve accessing green space, which does not mean that one needs to get to a national park. It could mean just spending time outside or bringing a plant indoors. For instance, I grew up in a very small apartment in New York, and we had a very tiny porch that my mother and I spent time on, and that was outdoor time that was important. So what are the things that we can do that we can control in our environment? That's the look around part. And for look within, we recommend that people learn more about their own mental health first by coming to the screening program and taking one of those free and anonymous screens.
Schroeder Stribling, thank you so much for joining us today.
Thank you so much for having me.